don't think people understand how crazy the brain is, and global aphasia is a good example of that. It all began when a neurologist fascinated by the brain had a patient named Louis Victor Leborn, known to everyone as Tan. Tan was a mystery. He couldn't speak, except for one word, Tan. No matter the question, no matter the situation, Tan was all he could say. This marked the beginning of the discovery of what is now known as global aphasia. There are many types of aphasia. Aphasia means that you have a language disorder that could make it hard for you to read, listen, write, and say what you mean to say due to a cerebral lesion. The most common cause is stroke, although it could also be due to traumatic brain injury, brain tumors, among other causes. Aphasias can vary greatly in their symptoms, depending on the location of the injury. In the case of global aphasia, the lesion tends to be very large and located in the left hemisphere, including anterior and posterior zones related to language. This region is called the parasylvian zone, which includes Broca's and Wernicke's areas. You can learn about these zones here. However, it's not always the case, since in very rare cases it can be caused by a subcortical lesion. This lesion generally includes all of the following subcortical structures simultaneously: the putamen, the posterior limb of the internal capsule, the temporal isthmus, and periventricular white matter. This leads to cortical hypoperfusion in the parasylvian language areas. If the lesion is caused by a stroke, it typically involves an occlusion of the internal carotid artery or middle cerebral artery, affecting both the inferior and superior divisions, resulting in a large wedge-shaped damaged area of 2/3 or more of the left hemisphere. This type of lesion leads to distinctive characteristics that help differentiate global aphasia from other types of aphasia. Global aphasia is the most severe form of aphasia, because it entails a combination of expressive and receptive language deficits across all modalities. This means it impacts language production whether spoken or written, as well as comprehension whether spoken or written. It's so severe that sometimes people are unable to speak at all, especially soon after the lesion. This is called mutism. This contrasts with fluent aphasias, such as Wernicke's aphasia, where individuals may produce a large number of words. You can learn more about Wernicke's aphasia here. Others speak only through stereotypes. This refers to the repetition of the same single word or non-word, regardless of the intended meaning. For example, a person may say only hello in any verbal context. This was the case of Tan. He only said tanned to everything. So, communication is primarily carried out through gestures, intonation, and facial expressions. They are able to do this because the functionality of the right hemisphere remains intact, which is the main center for processing context, emotionality, and the social aspects of language. As I said, comprehension is severely affected. Most patients do not understand anything at all. This includes single words, sentences, and conversations. This contrasts with aphasias such as anomic or conduction aphasia, where individuals have relatively preserved comprehension abilities. However, in a few cases, their comprehension is a bit better if it's a conversation about topics related to the patient. They may be able to answer yes or no correctly in response to questions about their family members, illness, or recent personal events. It has also been reported that some of these patients, despite their severely overall comprehension deficits, have a remarkably well-preserved ability to recognize the names of geographic locations and identify them on a map. The aphasia most similar to global aphasia is mixed transcortical aphasia, as both severely impair language comprehension and production. However, individuals with mixed transcortical aphasia can repeat words and phrases remarkably well, whereas those with global aphasia cannot. Additionally, it is common for individuals with global aphasia to have one or more additional impairments, such as apraxia of speech, facial apraxia, right hemiparesis or hemiplegia, and right homonymous hemianopsia. You can learn more about these impairments on our channel.